Everything can change in an instant. Just a moment ago, it was a peaceful dinner filled with laughter. But in a sudden, brutal flash, a stroke can strike. It steals their voice, paralyzes their arm, and can even take the life of someone you love. This isn't just a scene from a movie. It's a harsh reality that millions of families face every year. If you were there, would you know what to do? Would you have the presence of mind to act within those critical golden 30 minutes to save their life? Stick with us, because what you're about to learn might just be the most important thing you hear today. So, what exactly is a stroke? Imagine our brain as a bustling city, and our blood vessels are the highways that deliver oxygen and nutrients. When one of those highways gets blocked by a blood clot or ruptures, an entire neighborhood of that city gets cut off. The brain cells there, deprived of their vital supplies, begin to die. This is why time is so critical. Doctors call it the golden hour, the first 3 to 4.5 hours after a stroke begins. This is our window of opportunity to get the person to a hospital where they can receive life-saving treatment, like a clot-busting drug that can save those dying brain cells. In fact, some studies show that for every minute that passes, nearly 2 million brain cells can be lost. That's not just a number. That's a part of our memories, a part of our ability to move, a part of our life itself. And it all starts with you knowing how to recognize the earliest signs. So how can you tell if someone is having a stroke? It's simple, and it starts with a 4-letter acronym you must remember: F.A.S.T. Think of it as your personal first responder checklist. F is for face, drooping. Ask the person to smile. Is one side of their face numb? Does their smile look uneven or crooked? It might seem simple, but this is one of the most common and visible signs. A is for arm weakness. Ask them to raise both arms. Are they able to lift both? Or does one arm drift downward or feel weak and heavy? This is a crucial test because a stroke often affects one side of the body. S is for speech difficulty. Ask them to repeat a simple sentence, like, "The sky is blue today." Do their words sound slurred, garbled, or are they unable to speak at all? It's like their brain is trying to form the words, but the signal isn't getting through clearly. T is for time to call 911. If you see even one of these signs, don't wait. Don't second-guess yourself. Don't drive them to the hospital yourself. Call 911 immediately. In a stroke, every minute counts. Every moment you hesitate, more brain cells are dying. This isn't a dress rehearsal. It's the moment for action. Your quick thinking could be the difference between a full recovery and a life-altering disability. Sure, here's a rewritten script for the video, focusing on the do's and don'ts while waiting for help. So, you've called 911. What now? The next few minutes are crucial. Your actions can make a huge difference. Let's talk about what you should and absolutely shouldn't do while you wait for the paramedics. First, what you should do: gently lay the person down on their side with their head slightly elevated. This position helps keep their airway open and prevents them from choking if they vomit. Cover them with a light blanket to keep them warm. Stroke victims often have trouble regulating their body temperature. Most importantly, stay with them. Talk to them in a calm, reassuring voice. Let them know help is on the way. Your presence and calm demeanor can help reduce their panic and stress. Now, what you should never do: do not give them anything to eat or drink. Their ability to swallow may be impaired, and this could cause them to choke. Do not try to give them medicine, even if it's their regular blood pressure medication, Only a medical professional can determine the right course of action. And please, listen to this carefully. Do not attempt any unproven folk remedies like massaging, needling, or kaogyo. Not only are these methods ineffective, but they can also cause harm and, most importantly, waste precious time. Remember, the goal is to keep them safe and comfortable until professional help arrives. Everything else is a distraction. A stroke can happen to anyone at any time. It doesn't discriminate based on age, race, or lifestyle. But as we've learned today, your knowledge is your power. When you know the signs and how to act, you're not just a bystander. You become a lifesaver. This knowledge isn't just for you. It's for your loved ones, your neighbors, and your community. Think about your parents, your grandparents, your friends, the people you care about most. What you've learned in this video could one day be the knowledge that saves their life. So, I urge you to take a moment and share this video. Send it to a friend, post it on social media, or share it with your family. It takes less than a minute, but that 1 minute could be the difference between a tragic loss and a life saved. Your simple act of sharing this information could be the most heroic thing you do all day. Thank you for watching. But our journey together towards a healthier life doesn't have to end here. This is just the beginning. If you found this information helpful, imagine what else you'll learn when you join our community. Every week, we bring you practical, life-saving tips and stories that matter most to you and your family. So, if you are committed to protecting yourself and your loved ones, don't miss out. I have a special gift for everyone who wants to be proactive about their health. It's a comprehensive, easy-to-read guide on Stop Ignoring These 10 Stroke Warning Signs. After 60, Senior Health. This guide is packed with actionable advice you can start using today. To get your free copy, just send an email with the subject Stroke Guide to pedere6666@gmail.com. I will personally send it to you. And of course, don't forget to hit that subscribe button and click the bell icon. By doing so, you are not just supporting our channel, you are investing in your own well-being and becoming a part of a community dedicated to a long, healthy, and happy life. Thank you for being here, and I look forward to seeing you in our next video.